Hello, my name is Dr. Daulton Jr., and in today's video, we're going to be talking about medications for spinal disc problems. So the major types of problems that we're going to be talking about are a bulging disc, herniated disc, ruptured disc, and degenerative disc disease. And typically the treatments for these conditions are pretty much the same because they're basically the same problem, but they're different stages of the condition. So what I want to say about medications today is, number one, I want to let you know up front that I do not think it's a problem for people to take medications, and in fact, this is the most commonly recommended treatment for spinal disc problems because a lot of times it does give people relief. However, you have to be intelligent about this and you have to know what you're dealing with, because the types of medications that are usually recommended for people in these types of cases, they can have some very serious side effects, and in general most of them are not supposed to be taken for a long-term basis. And that's actually the problem that I see a lot of people run into, is that they tend to use these medications for far too long, and it can lead to a lot of problems. In addition to that, there's a lot of side effects that may affect the way that you function with these. For example, a lot of people will feel drowsy with these, or they'll feel like they don't have the same mental acuity that they have typically, because these medications can affect the nervous system directly. So you have to be really conscious about what you're going to be dealing with. Now, in general, even with all of that said, what I also want you to know, though, is that typically these medications do not work for a lot of people, and there's a very good reason for that, because I'm going to be explaining to you in just a minute on this image how the spinal disc works and how these conditions work and why that is actually the case for most people. But in addition to that, not only do they not work for a lot of people, for those of you who it does work for and who it does give you some relief for, usually it will not have a long-term benefit, because these are the types of medications that you'll typically develop a tolerance for. Some of them can also be addicting, so you need to be aware of that. But in addition to that, they typically don't fix the problem. So when you stop taking them, the problem will almost always return. So let me go and explain why that happens here. We're going to take a look at a normal, healthy disc, and this is what it looks like here. If we look at the side view of the spine, which is the image on the left here, you can see that we've got the bones stacked on top of each other, and between each set of bones is a disc. Now, the disc is basically a cushion that separates these two bones, and it's also a ligament, which means that it holds the two bones together. And if we take a look at the disc from the top down, which is what this image is over here on the right, what you're going to see is that it's made of a strong outer covering called the annulus fibrosus, and then a softer jelly center called the nucleus pulposus. Now, what's really important to notice here is the anatomy that surrounds the disc, because this is where our discussion today is going to become more crucial to understand this. If you look directly behind the disc, you're going to see that the spinal cord lives here, and then the spinal nerves will come off of the spinal cord and they travel out and talk to the body. Now, your nervous system is basically composed of your brain, your spinal cord, and the nerves. And what happens is that the brain controls everything, and the way that it does that is by sending messages through the spinal cord out through the nerves to different parts of your body, and then the nerves basically relay the messages and tell your body what to do based on what the brain is wanting it to do. So that's really how your nervous system works. Now, if we take a look at what happens when we have a bulging disc, if you look right over here on the right side of this disc, what you're going to see is that the disc will be damaged and it starts to bulge, but notice what happens. It's going to put pressure on that nerve. This is actually what causes most of the pain with these types of conditions, is the nerve itself, not necessarily the disc. Because if you think about it, the disc, its main function is to absorb shock all day. And so the way that it's designed is that there aren't a lot of nerve endings that go into the disc. So a lot of times people will have this problem and they don't even know it until it starts to put pressure on this nerve, and that is very, very painful. Not only that, but whatever this nerve controls is going to start to be affected as well. And that's why you'll notice that a lot of your symptoms aren't just localized to the back. The symptoms will tend to go to other parts of the body as well. So why am I telling you all of this? Well, remember, we're talking about medications today. Most of the medications are designed to do basically one thing, and that is to numb this nerve. So if you think about it, you're taking these medications, and like I said, sometimes they do help people, but really you're not fixing the problem. You're numbing this nerve so that you think you're better, but in reality it hasn't done anything to affect this disc bulge. Now, some of the medications will reduce inflammation, some of them will actually work at the level of the central nervous system, where they're tricking your brain and your spinal cord into thinking that there isn't any pain when in fact there is still a problem present. And this is why a lot of times the medications don't work for the long term, because you're not correcting the actual problem itself. In addition to that, this is the reason why when you stop taking the medications, the pain almost always comes back, and the reason is because, once again, you have not corrected the actual problem. So what I've done here is, if you go to my webpage, I'll have a link to this underneath the video. If you'll just scroll underneath the video that you're watching, you'll see a section that says About, and I'll have a link there that you can click on and it'll take you to this page. But what I've done is, on my website, I've created a page that discusses basically what I just discussed with you, but I also list out all of the different medications that are recommended for you, and you can look through the list and see what it is that you're taking, or anything that you're curious about. And all you have to do is, when you find the medication that you're interested in, you can click on the topic in that section, and it will take you to a separate page that talks specifically about those medications. And then in addition to that, I have information about the side effects and also any drug interactions that may occur when you take these medications. Now, as we've discussed, these are not actually the best option as far as for treatments are concerned. If you go to the page, or really any of the pages on this website, and you scroll all the way down, you're going to see that I have a table of contents here, and these are all of the different topics that I've discussed on this website. It's really a complete resource for you, and it gives you all the information that you need to know, not only to understand what the condition is, but also in order to treat it properly so that you get the best results. So you can see down here I've talked about what the problems are, the symptoms, what causes the problems. Here's a list of all the treatments, so we have all the medications listed out here, natural alternatives that you can take to the medications, exercises. I also have a section here on surgery, just to give you the statistics on how effective surgery is and whether or not you should be considering that. And then finally, the very last link on the page is a program that I've developed where I help a lot of people with. And basically what it is it's a step-by-step program that allows you to heal your bulging disc or your herniated disc or whatever the spinal disc condition is that you're working with, and it's really effective for the majority of people. You can see it has a 90.2% success rate, and that's really high for most spinal disc problems. So if you're interested in that, you can click on this link and it'll take you to that page. Alright, thank you so much for taking the time to watch this video. I hope you found the information helpful, and like I said, I've got this resource for you here that you can go to where you can get a lot more information about the different medications and what they do and that sort of thing. So I strongly encourage you to go ahead and click on the link below the video, and I hope you have a great day.